Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going.
Karibu Tophill Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Tophill Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA-filtered theaters with laminar airflow. Our aim is to provide comprehensive quality services at an affordable cost to the community, which includes but not limited to neurosurgery, radiology and diagnostics, MRI, CT scan, X-ray, ultrasound, endoscopy, ECG, EEG, pediatric cardiology, physiotherapy, orthopedics and trauma, pharmacy, laboratory, theater, ICU and HDU, obstetrics and gynecology, general surgery, maternity, psychology, psychiatry, comprehensive wellness checkup, dialysis and urology, oncology, dental care, ENT surgery, nutrition and dietetics. For ease of movement and transfer of patients, the hospital has 2 modern critical care ambulances equipped with ICU facilities and available 24 hours. Tophill Hospital is located in a serene environment away from noise and has a cafeteria with fresh, nutritious foods, not forgetting ample parking for all clients. Tophill Hospital is NHIF accredited and accepts medical covers from a number of insurance companies. If you're looking for the best customer care and patient experience and to be attended within the minimum waiting time possible, reach us through the website www.tophillhospital.com or call 0782 121214, or you can also call 0782 900090. You can also email us through info@tophillhospital.com. Tophill Hospital, exceptional technology, extraordinary care.
The 15th day of March 2023. My name is MC Kalia. This is the Morning Glory Show. It is the most comprehensive talk show in Kenya today. Now, before you go far, allow me to remind you that we are coming live from Dawi Afrique Photography. Dawi Afrique Photography is situated in Eldoret at a place called Zion Mall, basement of that particular building. So anytime you're within this region and require anything that goes into video and photo production, consider working with Dawi Afrique Photography. Now remember this, you need a good experience in front of the camera, and at the end of it all, you need quality, well-documented work. That is exactly what we do at Dawi Afrique Photography. Just to add on it is that we're expecting the ceremonies to start. Of course, this is a festive season for the region, and if you're looking forward to hosting a wedding or a pre-wedding or any other kind of ceremony, then also consider us to document the work for you. Moving forward, if you ever have interest in fashion, the right place to visit would be D Square School of Fashion Design and Tailoring. That is where you train to be the best. Why am I saying this? D-Square School of Fashion Design and Tailoring is situated just next to D-Square Fashion House. So that means students get a chance to train also at the fashion house. So immediately you need practicals, you just walk into the fashion house. Both D-Square Fashion House and School of Tailoring and Design are situated at the 4th floor of Ketia's building, that is in Eldoret. Now, moving to today's topic, of course, it is a healthy, wealthy Wednesday, and we're actually glad to have one of the biggest doctors within this region. I would say one of the best neurosurgeons within this region. That is Dr. F. Koech on set. Dr. F. Koech is the lead neurosurgeon at Tophill Hospital. Tophill Hospital is a level 5 hospital situated in Eldoret town. Apart from that, I need to remind you that with this experience of spanning over 25 years, is a resource in the medical practitioner. Dr. F. Koech currently his hospital receives around 800 surgeries in a year. And apart from that, the hospital has 100 surgical beds. Now, trust you me, his passion goes back to when he was 10 years in a bed, and it was through an intervention of a neurosurgeon that he got healed, and that is what drives his passion. Now, why would I be speaking when we have him on studio? So, karibu sana daktari, and say hi to our viewers.
Good morning. I'm happy to be here today. It's my pleasure always to be here and talk about what we do, and of course comment about issues, health issues, which are currently in Kenya. So thank you so much.
Okay, thank you so much for that. And Daktari, many people are wondering what is today's topics. Of course, there are those who may not have seen the poster. The topic today is care for the spine. And somebody asked a very good question yesterday. What actually is the spine?
Okay. Well, the spine, just like I'm sure many people remember biology, is that skeleton at the back. It comprises of about 33 bones, which form the framework of the skeleton. It's that structure that supports the head and connects the head with the legs. So in between there are bones, muscles, ligaments, and what we call the discs. All that comprises the skeleton, and that is what we call the spine.
Okay, of course, this conversation will just be touching. Of course, so many people, I noticed that there are already questions coming in, somebody asking about sciatic nerve and all that. But then maybe I just need to remind my viewers that, of course, we shall be talking about the spine. But then beyond that, you can always reach Tophill Hospital and actually get to have Daktari one-on-one. Daktari, talking about the spine, somebody would ask, what are the components of the spine? Before we look at caring for it, then what is, maybe if there's a way you can classify each part of the spine and the care that it needs?
So the spine has about 4 components. Usually the cervical, that is the neck. We have the thoracic, the lumbar, and the sacrum. So those 4 structures are different in a way. Cervical, for example, is about 7 bones. Thoracic is about 12 bones. Lumbar is about 5, and the sacrum is about 5. So all that comprises about 33 vertebrae. Each bone is, in terms of structure, is suited to the function. So cervical will be different from the thoracic. And inside that bone runs the spinal cord, the main structure that coordinates the body. So really, this skeleton just houses the spinal cord. Now, the spinal cord has exit elements, which are called the nerve roots. From each point, it exits out to a certain specific area. Otherwise called in medical term dermatomes. And so the cervical has 8 nerve roots. Thoracic has 12 nerve roots, and the lumbar has about 5 nerve roots, all exiting to specific areas of the body. Now, if there's a problem that there's compression of which one of the nerve roots, then you have the symptoms. So sciatica, in a way, is just the compression of one of the nerve roots or several exiting at the lumbar area, going to the leg. So when you compress those nerves is when you have pain. And so people can present with pain on the leg, and that term is called sciatica. I hope I've explained.
Okay, thank you so much for that. And the biggest question that came after the people saw the poster was the lower back pain. Of course, we'll talk about other conditions that are related with a spine that may not have been well taken care of. But then the one that came in so much was lower back pain. What causes the lower back pain?
Now, low back pain has several causes, depending on the type of pain. But generally, the causes are multifactorial. It could be the type of work we do. It could be an accident, for example. Somebody has fallen down and injured the low back. Or it could be the type of work we do, like the way we sit for long hours, can also cause low back pain. All those are different causes of low back pain. But generally, the symptoms will be almost the same, low back pain, but different causes. Maybe I can break it down later about each specific cause and probably what to do with it. Yes.
Okay, and just before we come to those conditions, then just allow me to also continue reminding those who are streaming in that this is the Morning Glory Show coming live from Dawi Afrique Photography. With us in studio is Dr. F. Koech. Okay, his full name is Dr. Florentius Koech, but then many, me included, prefer to just call him Dr. F. Koech, and I'm sure he loves that. He's a lead surgeon at Tophill Hospital, a level 5 hospital in Eldoret, specifically and most of the times dealing with cases that touch on surgical or rather neuro cases of or neuro conditions, of course. Daktari, some of these medical terms may need your intervention. But then also, as we go deep in, allow me to sample a few of the comments. Of course, so many people coming in already. I can see Terry Jerry saying, good morning. Ask Daktari about sciatic nerve, the pain that numbs the right leg, effects of the long use of MR muscle relaxers. Okay, thank you so much for that. Ambassador Alfred Sargent from all the way from Perth says he's tuned in. Mildred Sum, thank you so much. Rapuria says health is wealthy. Thank you so much for making time to be with us. Ask those questions that at the end of this particular broadcast I'll be able to answer, to give Daktari a chance to answer all of them. Now, Daktari, before we go to the conditions, what is or how does a healthy spine look like?
Now, a healthy spine is the way God made us is that the spine has a certain shape, almost like an S. It's not, the back is not straight. It is S-like. So that the upper in the neck, it's like a shallow C. The thoracic is the opposite. It's also a shallow C. And the lumbar is another C, again, shallow C. That's how God made us. So the essence about this normal spine is that we should always try to maintain that natural curve. The moment that shape is different, it can cause pain. And that is where we always advise about posture at work, posture at home, basically to keep that spine in shape. Yes.
Okay, thank you so much for that. And you've talked about the S, and I think that is where we're coming next. Of course, we'd already mentioned about the lower back pain. Of course, that means it occurs at the end part of that particular S. Yes. And I asked that is where we start this particular topic. Apart from, when you talk now about the lower back pain at a close range, talk about the conditions that affect the lower back pain and how they present.
Now, there are several conditions, but let me specifically start with probably the most common, going to the least common. One of the commonest conditions that causes low back pain is actually what we call a disc protrusion. Now, in between each vertebra, there's a disc. A disc is actually a cartilage, a soft tissue. But many times, it wears out very quickly in most people. In fact, when you're about 25 years old, about a quarter of people have already disc problems. By the time you reach 40 years, about 2/3 of people will have a disc disorder. By the time you reach 60 years, almost 90% of people have a disc in one way or another, something related to that disc. So it wears out with time. More so the type of work we do. If we do a lot of work like where you're lifting, or where you're bending so much, then it wears out quickly. So disc disorders form the majority of our problems that causes low back pain. Apart from discs, there are muscles. When there are muscle spasms or any disorder related to the muscles, that can also cause pain. And then the third category is where there are issues to do with the bone. The bone can either fracture, maybe in an accident, or it can also wear out because of other issues to do with bone metabolism, or tumors infiltrating the bone. That also causes a lot of pain. So those are the big categories of low back pain disorders.
Okay, thank you so much for that. Thank you so much for that, Daktari. And when you talk about now the low back pain, of course, you've mentioned that by 25 years old, somebody is already could already be having problems, and the numbers worsen as age goes by. Now, if you were to maintain or you were to avoid having the lower back pain, what are some of the interventions at a personal level that somebody needs to make to actually a little bit make sure that we reduce the numbers of those presenting with low back pain?
Thank you again. There are several factors that we always advise to avoid low back pain. And these factors range from even food, the way you eat food, the way we sit. But let me start with lifestyle problems. One of them that we really advise against is smoking. And the reason why I've started with smoking is that it's a common thing in the youth. You know, people smoke. I mean, the majority of, about some percentage of youth smoke. Smoking interferes with blood supply to the bones. It reduces the blood supply to the bones. So the more you smoke, the more you reduce the blood supply to your tissues, including bone. And what happens? With time, it degenerates. So we always advise, if you must take care of your spine, avoid smoking. The type of food we eat also matters a lot. People who eat a lot of high calories or things with a lot of sugar also interferes with bone metabolism. And so people who really like sweet things tend to have bone disorders. Things like weight. Weight is a factor. Because you remember the bone, the backbone, bears weight. Being overweight actually causes degeneration of the spine. Because the more you load that spine, the more it degenerates. Just like in a car. The more you load, the more you finish your tires. So by induction, we advise that we need to reduce weight as much as possible. That weight that you don't need, you need to shed it off. The other factors that also are very important, like posture. Posture at work, the way you sit, and the type of seat you're using at work, especially people who sit for long hours, people who are sedentary for long hours, seated in a certain position. If you sit in an improper position, it also affects your spine. So those are the real main factors. The other factors like, exercising. Exercising tends to tone up the muscles, and that helps the spine to maintain that shape that we talked about before. So those are, in essence, the basic things that we advise. There are others that I may go into later, especially the medical factors that I'll also talk about later. Yes.
Okay, thank you so much. And Daktari, talking about ages, how different is it for a young person and an old person, of course, in terms of management, because that is where we are going next. How different these, I would say, this pain and conditions present in young people against old people? Is age a factor?
Age is also a factor in a way, though the pain is still the same. The pain you get when you're young and the pain when you get when you're older is largely the same. But of course, there are other factors that are more common in young people, and there are factors that are common in older people. Of course, in older people, other factors come in, like maybe tumors, which can also affect the lower back. Degenerative conditions, like the wear and tear of bones, are more common in older people than younger people. And then lifestyle conditions are more common in younger people than older people.
And is it natural for the bones to wear out at that particular area, or it is just because maybe, as you said, because of our day-in, day-out activities?
Of course, it's a natural process that we cannot prevent. Age is something that you cannot avoid. You know, growing old is something that is natural, it's physiological. And so, being the weight-bearing parts of the body, they tend to age with time as well. And that aging is what's called degeneration. So it's just the wear and tear of the body.
Of course, that question comes in as somebody asked why we are now having more young people presenting with lower back pain. Of course, maybe this is an older person referring to maybe their days. Is it because we are getting the diagnosis for such pain is, I would say, technology has gone forward, or is it because lifestyle has also changed at this time? Because we expected that this time we have so many tools compared to the past. Why are we having more young people presenting with such pain?
The way I would put it is that things have changed a lot. When I started practice, we never used to see as much low back pain as we see now. And I think basically it's because of the things that we do that have changed. For example, I'll give an example. You know, we no longer, if you want to go from point A to point B, even if it's a short distance, what do people do? They jump into a motorbike because it's easier, it's quicker. But it contributes a lot of low back pain because, you know, motorbike that vibration tend to affect the back. And two, you're no longer exercising. You're no longer able to walk the way we used to do. You know, you want to save time, so you jump into a motorbike. In the sense that you're not exercising your back as much as before. The food we eat have changed a lot. You know, we are no longer eating the natural food that our forefathers used to eat. We're now eating all this caloric, high-value food that affect our back. So all those are different. Our lifestyles have changed. All that significantly has contributed to higher incidence of low back pain.
Of course, and the next thing we'd want to look at is the management for this particular pain. First of all, when do I see a doctor?
Now, if pain persists, you know, when you get back pain once, maybe you take Panadol to contain the pain. If that pain persists for more than 2 weeks and you're still having the same pain, it's time to see a doctor. And the essence is just to rule out other conditions that we may assume. You know, tumors, for example, are now more common again. And you may assume and you find that maybe there's something that is growing in your back. It's good to rule out as early as possible so that you can get early intervention. The late interventions always result in more complications. So it's very important that you see a doctor as early as possible.
And Dr. of course, many people are anxious about what happens with low back pains once you get into the hospital. Of course, I had people talking about of course, I know you'll mention issues of surgery, issues of medication and all that. What is the process? Once I walk into a hospital, let's say, take an example of Tophill Hospital, presenting with low back pain, from a client perspective, what do I expect to happen at hospital?
Well, the first thing, of course, is usually assessment. We do assess to find out what exactly is the cause of that back pain. The majority are usually simple things that you don't actually need to do much. It could be just because the way you're sitting in your office. So we try to correct all that, like improper posture. And I would say that 80% of people who have low back pain have no much of concern. It's just probably they have done something wrong, they've lifted badly. The way we lift things is actually wrong. You know, you're not supposed to bend your back. But many times we do things quickly, we bend your back, you lift something that is heavy, and that can cause back pain. The way we sleep again also is very important. Maybe you have a wrong mattress that is not supporting your back, and that can cause low back pain. So I would say, when we listen, we assess, we always come up with a diagnosis, and that diagnosis is very important. And it may lead to just simple intervention. And for majority of the people, that is enough. A few may need to go further and do assessment in terms of radiological. And here I'm talking about things like X-rays or MRIs that are more specific to the back. It shows exactly what has gone wrong. And once we know what's gone wrong, then at that point we can intervene. And again, I would say many times surgery is really the least of the things that we do. We always try to avoid surgery as much as possible. And also, we advise other interventions other than surgery. Things like exercising, losing weight. Those are the simple interventions that we advise. Yes.
Okay, and of course somebody had talked here about, of course, people have been mentioning so much about surgery. I noticed that somebody is even sending me a picture of a certain belt, and I told them, okay, of course I don't know much about it, but Daktari will be here to talk about it. Let's now go to the small amount of number of people who would need to go further, more than just maybe coming into the hospital, walking in as a walk-in patient and going back home. Let's talk about a lower back pain that has persisted and you've found maybe a more serious condition. Maybe what are some of these, first of all, serious conditions that you find out? You've mentioned tumors. What other conditions do you find out, and take us through the intervention?
Again, I would start with the simple things. A disc, that disc between the bones may actually protrude out of its normal position, causing compression of the nerve. Sometimes it's simple, a small protrusion. Sometimes a big disc, a big fragment, has chipped out and caused compression. One of the emergencies that we face often is what we call cauda-equina compression. So cauda-equina is where there is now a big tissue of a fragment that is causing significant compression of the thecal sac. That end of the spinal cord in the lumbar spine is called a thecal sac. When there is that compression, then it becomes an emergency, because it's hard for somebody to recover from it once you allow the compression to persist for long. And so one of the simple things is what's called decompression, removing that part of the fragment out of that area where it's causing compression. That is simple enough, just removable. But there are other interventions that are advised sometimes. We sometimes do what's called discectomy. That means a simple decompression. This can be done either what we call minimally invasive, that's endoscopic, or sometimes it's an open. Open means you've made a small incision on the spine. And on the other hand, the minimal invasive is there's no incision, it's just a small strap on the skin, and we use a camera to remove some of those discs. Those are the simple interventions. But sometimes we do further and do what's called fusion. Fusion is where we now put screws on the low back. And the reason why we do that is because of instability. That means that the degeneration has gone so much that the spine now is unstable. The facet joints, the joints that fix one bone to another one, are loose. And at that point, the only way to stabilize that spine is by putting screws. And so it's called fusion. That is really complex. And that can range from simple fusion to complex fusion. Complex means it's more elaborate, involving more gadgets, more implants. And those are some of the procedures that we do often. So it really ranges. Intervention ranges from simple measures to complicated procedures.
Okay, of course, this goes to my view. Some of the people, some of the things Daktari mentions have actually been handled previously when he talks about radiology. The reason why I may not ask so many questions about it is that actually we had a radiologist also from Tophill Hospital who talked about what happens once Daktari sends somebody to the radiology department. So these sessions have been building into each other, and if there is a session you may have missed, then just check within our page. There is a link that will take you to exactly what you're looking for. We've talked about physiotherapy. Of course, he's mentioned it, but then we may not go deep into it because already somebody has actually tackled it. So for the purpose of this particular conversation, Daktari, somebody sent in, I wish I could show you the image. There's a mushipi somebody sends you, and talk about it for a little while. What is that mushipi, first of all?
Okay. Oh, that mushipi is actually called a brace, a lumbar brace, or rather it's also called a corset. Essentially, it's just a support structure for the back. And this can range from the upper back, the thoracic, to low back. So there are several types, depending on the indication. In essence, it's just to support the back. Things can be used when there are muscles problem, like there's a lot of stiffness of the muscles. Then you use the corset to hold the muscles in place. Or sometimes it can also be used where there is instability, simple stability of the back. So you use it to hold the bones in space. Now, the only trouble with the corset is it's an aid. An aid always is like you're helping your back. So if you use it for long, your back becomes weaker. Your muscles become weaker. So we always don't advise use for a long time. We use it intermittently. Intermittently means you only use it when you need it. When you don't need it, you remove it.
Okay, of course, the reason why I also spend a lot of time with that is because so many people, when you talk to them about back problems out here, is like, I mean, kona mshipi, I'll always be okay. That's why I was actually asking Daktari for clarification about that. This is the Morning Glory Show coming live from Dawi Afrique Photography. Wednesday session, we have with us Dr. F. Koech from Tophill Hospital. Tophill Hospital is a level 5 hospital situated in Elgon View, Eldoret. So many ways to reach Tophill Hospital. I usually tell people that every way in Eldoret leads you to Tophill Hospital. If you're coming from Nairobi, there's a road just past Poor Place that will actually, just on your left, that will actually take you straight to around the temple, and you're able to also access Tophill Hospital from there. If you're coming from Kisumu, around Nairobi Road there is a way, there is a signpost there indicated that will always take you to Tophill Hospital. So whichever the direction you're coming from, there is always a road that will take you to Tophill Hospital. Now, another landmark is that Tophill Hospital is situated just next to Boma Inn Hotel. So anytime you would wish to see a doctor, if you would want to see Dr. F, there are those of you who've already gone there and met him person to person. That would be better because, of course, the questions we ask is just to guide you and help you understand where you can get help. Now, Daktari, moving on, I would want to talk about the tumors just before we move into maybe the other part of the C. Let's talk about the tumors that occur in the spine. What is the causes of it and how do you manage it at hospital level?
Again, tumors are varied depending on other factors like age and also what type of tumor that we're dealing with. But I think what's more common for us is in the older generation, especially people with prostatic problems. That means males who have prostatic cancer. The first place that they metastasize to is the spine. So very common that you see somebody who is over 50, over 60 years old with low back pain. So we try to investigate to see whether there are other causes like prostate cancer. But apart from that, there are other conditions, bone conditions that tend to have tumors, especially something called multiple myeloma. Again, it's a very common condition in our region nowadays, that somebody who presents with bone erosions, and when we investigate further, you find that somebody has a tumor of the bones called multiple myeloma. Apart from that, there are also other tumors that involve structures around the spine, like muscles. So something called rhabdomyosarcoma is something that involves the muscles, and sometimes it goes into the spine as well. Apart from that, there are also tumors that are involving around the spinal cord, like meningiomas, can also grow around that area, as well as other smaller tumors that I don't want to talk, that are more detailed and may not be useful here. So they are quite common. Though it's a rare, in terms of category, I would say about less than 5% of people who have low back pain
present with the tumors.
With tumors, yes.
Okay, and apart from prostate cancer, what the other risk factors that may predispose somebody to tumors at the low back pain?
Of course, a small category of people who have other tumors in the body, like probably somebody has a breast tumor, lung tumor, they always tend to metastasize to the spine. Okay. Yeah, so, but again, as I say, those are small category of people, okay. Less than 1%.
Okay, thank you so much. Now let's move to the middle part of the S. What are some of the common conditions that affect the Okay, you
Thoracic.
called it the C.
Yeah, the thoracic. Maybe you go up to the thoracic.
Yeah, the thoracic part of the spine.
Yes.
What are the common conditions that affect this particular part?
Mostly what happens in the thoracic spine is the type of conditions that we see often are usually trauma. When somebody gets an accident or a fall, they tend to injure the thoracic spine. And so fractures form the big majority of causes of thoracic back pain. Be it a simple compression, like a wedge compression, or a chip fracture that results in injury of the spinal cord. All that are probably the commonest causes of thoracic back pain. Of course, there are other causes, like, again, degenerative, like discs that tend to protrude and cause compression. And then, of course, tumors also form a big majority of thoracic spine injuries. So there are many things, but mainly trauma. Trauma is a big category here. Yes.
And of course, that maybe informs also the reason why so many questions were about the lower back rather than the middle part, the upper part of it. And in terms of that, then we may not also take a lot of time in discussing that, because majorly then it will mean that most of the people must have been exposed to either accidents or something like that. Yeah. Let's go to the last part of the C before we come to talk about nerves, because I also noticed so many people talking about nerves.
Yes, yes. So again, the cervical area, the majority of people who come in to see us are basically because of maybe the type of work they do. You know, nowadays, almost everybody has a laptop, and they sit down for long hours, you know, on their laptops, or in younger people, phones. You know, the way you hold your phone, you're scrolling through, you bend your neck. So many times people get back pain or cervical back pain because of just the posture, the way you bend your neck to look at things over a long period of time. So if you're on your laptop for 5 hours, definitely at the end of a week, you'll have a problem with your neck. So majority of people is just because of posture. That may result eventually to compression of the cervical nerves. So somebody may present with tingling of or numbness of the fingers or pain along your hand. That is because of the neck pathology. And so people will always come up, oh, now my thumb is numb and painful. And when you investigate, the trouble is at the neck. So it's usually disc disorders at the neck. Apart from that, of course, you know, it's the neck or the cervical area is the junction between the brain and the spine. So there are pathologies that are around what's called the craniocervical junction. Again, those are rare disorders. So I would say the bulk are usually because of posture-related disorders.
Most of them are about posture. Then, Daktari, the biggest thing you've mentioned today is about posture, and so many people would ask, what is the ideal posture, maybe for sitting down, for lifting objects, and also for sleeping? Because those are the three major ones you've actually talked about. I know you may not display them much, but then...
Yes, I would just describe. You know, the best posture is the one that is natural. It follows the way your back is. So the neck should be looking straight, not bending forward. Should look at least about 10 or 20 degrees up. So even when you're setting your laptop is actually not the best for doing serious work, long serious work. It's supposed to be a desktop. And the whole idea is that the screen level should be at the level of your eyes. Yeah? And the seat that you're using should be orthopedic. Orthopedic in the sense that it is contoured to support all the spine, from the neck all the way to the lumbar area. And it should follow the way your back is. It's a curve, a certain kind of a curve, like an S. That is the best seat. So it's called an orthopedic seat that can support your back. It can support your legs, and you're able to swivel. You know, when you're walking on one station and you want to do something else, you swing without having to turn your body. turning your body frequently will cause trouble. So that's the best position for sitting. Again, you should not sit for long hours. The best is to do what's called intermittent breaks. Sit for 2 hours, take a break. Sit for 2 hours, take a break. But sitting for 5 hours continuously, you're actually hurting your back. When we come to position of sleeping, as I said before, again, the best position is where your back is fully supported. It should not sag. You should not have a mattress that sags, that sinks, so that when you sleep, you're like almost like a bend, like a curve, like a semi-cycle. No. It should be able to support your back. So a straight mattress, a firm straight mattress is probably the best. And there are many types of mattresses, ranging from orthopedics to contour mattresses. That's what usually advise, that somebody should have a real firm mattress. And that should be the basic. You asked something
Lifting
else.
objects.
Yeah, lifting. So let's come back to lifting. Lifting, we should not lift when you're bending your back. The best actually is to use your legs, so you're squatting, and then you try to lift. It's better to damage your knees than to damage the back. So the best position is you keep your back straight without bending, and then lift. Yes.
So that means actually that somebody needs to squat somehow, then now lift a heavy object.
Exactly.
Okay, then I think that is the opposite of what almost everyone does. Most of the people usually just bend and lift.
I know. It's natural to do that, but that's wrong. If you do that every day for a long time, you'll be hurting your back, and you'll present to hospital with low back pain. So it's always good to do the right thing. And the right thing is keep your back straight, irrespective. Whether you're lifting a small thing or a big thing, keep your back straight.
Keep your back straight. I think that's the biggest lesson so far that you need to. I think that one, I'm also a victim of that. Just when you want something bend and just pick it up. And
I know.
There are times you feel a small pain. I think it was just a little bit heavy. But then nonetheless, you've already lifted it up. We are coming live from Dawi Afrique Photography. With us is Dr. F. Koech from Tophill Hospital. Now, Dawi Afrique Photography is situated in Eldoret, Zion Mall, and we are not actually docile here. So that means if you have any other kind of work that you may need us to document it, we'll be able to come to where you are. A good example that we give you a good experience in front of the camera is Dr. F. You can see him already smiling. So that means that here you get a good experience in front of the camera. Nonetheless, Daktari, let's come back to nerves. So many people have asked me about nerves. There's somebody, I think it was among the first questions, somebody asked something like, talk to me about sciatic nerve pain that numbs the right leg and the effects of use of MR muscle relaxant drugs.
Yes. So sciatica essentially is pain that radiates from the back down the legs, basically following a specific pattern, depending on which nerve is involved. So there are several, from what we call lumbar number 4, number 5, sacral number 1, 2, and 3. Those 5 nerve roots comprise what's called the sciatic nerve. So sciatic nerve is a big bundle of nerve that's arising from the low back and running all the way to supply the muscles of the leg up to the foot.
And how often do you get these kind of conditions at a hospital level? Because I realize that there are also so many people asking about those pains coming from the back going now down to the legs.
Okay, so any pathology in the back that will compress those nerve roots will cause sciatica. So sciatica is just a symptom. It's a presentation. So somebody will present with either numbness initially, or what's called paresthesia, and eventually it will lead to pain, a certain type of pins and needles along the distribution of that nerve. That's called sciatica. So basically, it's a very common symptom for most of our patients. I would say out of people who present low back pain, probably about 50% will have symptoms related to sciatic nerve. So it's a very common thing. And measures, again, as I said before, we do simple measures generally, just to avoid that compression at the low back. That means doing exercises, physiotherapy. Usually it's the simple things that really make a difference. The way we sit again makes a big difference to relieve the pressures on that nerve root. Occasionally, then we proceed on now to do other measures that may involve relieving that compression, including even what we call epidural injection. That means we give an injection into around that nerve root exiting, and that tends to decrease the inflammation on the nerve itself, and that relieves the pain. Yes.
Okay, and of course, so many people will ask about the drugs. I see, of course, for all the conditions you've mentioned, or rather the complications you get with the back, the next question that comes in is during treatment, of course, because you'll use drugs, the side effects of those particular drugs, and how long do I need to be on drugs before maybe I also get back to normality?
We always give a specific regime, because you don't want to get used to drugs for a long time. Because, using this what's called analgesia, that's pain relief medication, also tend to cause other complications, like they corrode the stomach. So somebody may end up with ulcers eventually. So we tend to use it for a short period of time. And usually we recommend that somebody, when upon presentation of sciatic nerve or sciatica, we give a bed rest. So we always try to get somebody to rest so that it relieves the pressure on that nerve, usually for about 3 weeks, plus medications. After 3 weeks, then we review to see if there's any change. And if there's any change, then we escalate the treatment to the next level. Again, probably for another 3 weeks. So usually short periods of 3 weeks, 3 weeks, 3 weeks. 3 weeks. If at the end of that period, maybe about 6 weeks, and there's no change in terms of pain, then at that point now we go to other invasive procedures like that, injections, or at that point we can start discussing about surgery.
Okay, and let's also talk about the issue of insurances in relation to spine disorders. How willing are insurances to cover cases of the spine, and how expensive is it to treat?
Now, insurances come in many ways. One is they do help to do the main investigations to make a diagnosis. And the main investigation here we're talking about is usually MRI, because X-ray may not show much, CT scan may not show much, but MRI is really the investigation of choice for somebody who has chronic low back pain. Now, NHIF, which is probably the biggest insurance we have, do pay for the MRI, be it comprehensive NHIF or is it the normal national scheme, though they have, NHIF has their own categories on who they approve for and whom they don't approve for. But if somebody doesn't have an NHIF, then at that point they may need to pay for the investigation. And MRI generally ranges between 10,000 to 15,000, depending on whether you had what's called contrast or not. So it's really an expensive procedure, an expensive test. In terms of treatment, again, most insurances do cover the treatment for low back. Even NHIF, again, although the national scheme may not be giving so much in terms of cost, in terms of meeting the cost for low back pain, but other insurances do cover for the cost, and they are not expensive. For simple procedures, on average, it costs about between 250 to 300 if it's just a discectomy, which again is fully, mostly NHIF covers fully. And then if you proceed on to more complex surgeries, then at that point, of course, NHIF will cover probably about a half of it. And if somebody has an extra insurance, that is met by the other insurance. Yes.
Okay, thank you so much for that. Of course, so many people watching at the moment. I can see one of your people, that is Bernard Nyasimi, was here to teach us also about posture, and he says, wow, good posture and good body ergonomics. Okay. Ergonomics. I hope I'm reading that right, Daktari.
Yeah, ergonomics, yes.
Okay, thank you so much, actually. And thank you so much, Nasimi, for the work you did. You realize that the questions are fewer right now because of what he actually did. There's also CK Kim saying, getting you loud and clear, Nikiwa Hapa Town. There's Dan says, educative. We also have, okay, Kimori Prisk says he's tuned in from Cabenas. Fanuel George says, very educative. Thank you, Daktari, for the insights. Kaltio Nasari says, good morning, tuned in from Dukamoja, Kipkorgot. Queen She says, good morning, tuned in. Thank you so much. What kind of foods help the spine? I think that is something that Daktari can handle. Then there's somebody says, good morning, Daktari is one of the best neurosurgeons of our time in regards. He saved my life and the life of my husband, who had a deadly head injury back in 2014. He is a down-to-earth person. May the Lord bless him and give him more knowledge and wisdom to serve. Thank you so much. Of course, so many beautiful messages towards you, Daktari, and so many people celebrating you. I may not read all the text at the moment, but then that clearly shows that there's some good work happening at Tophill Hospital. Now, we've talked about management and all that. Daktari, the biggest question that comes in next is, of course, the issue of success and the issue of going back to normal working ability after these particular procedures. I realized that so many people feared going in for maybe surgeries or procedures that involve going to just beyond the medication. First of all, why is it that our people, from where you sit as a doctor, why is it that most of our people fear surgeries? And if you are to convince them then for surgeries, because you also say that maybe it's the last thing you do, before you go there, what would... okay, I would say what informs the attitude of our people not wanting to go in for surgeries? That would be the right question, rather.
Okay. Of course, surgery is not something that you want to rush to. And so even as doctors, we don't rush to do surgery. We try all other means first. And when all other measures have failed, at that point, we decide to advise for surgery. But let me start by saying that there are a lot of myths. Myths is, wrong information about something. And one of the things about surgery is that in the past, even when I was in training, there were many complications as a result of back surgeries. And the reason why there were many complications then was because of one, technology. We didn't have enough technology then. We had the basic, maybe CT scans. We never had MRI. Most of these MRIs we are seeing now, the high technologies, came in the recent past 15 years, for example. So before that, there was a lot of issues, We had to do explorative surgeries to look for pathologies. And of course, with exploration, you expect a lot of complications. So people come from that era where there were many complications. Somebody goes in for surgery and comes back on a wheelchair, for example. And so people have that in mind, that, hey, I may go in and not be able to walk again. But I would say that things have changed a lot over the last 10 years. We now have better technology. We now have better equipment. And I would say also the skills have changed a lot. The training, we've gone through a lot of training. And now there are specific people who do spine, and they're called spine surgeons. And so somebody must have gone through a rigorous training process for you to come up with a spine surgeon. Before, we never had such people in this country. So I would say things have changed a lot. And ever since my practice, all those complications have gone down a lot. We rarely see people coming out after surgery on wheelchairs. No, few. And the few is because of other factors. So I would say those myths are now past. We need to change our concept and know that once a doctor has advised, then there's a reason why there's that advice. But as I had said before, we don't rush to surgery. We try to avoid surgery as much as we can. And when we cannot avoid at that point, then we advise.
Okay, I thank you so much for that. And Daktari, unless there is something that is specifically you feel we may have forgotten to capture, then we would want to start wrapping up the show.
Sure. Maybe I need to talk about, again, somebody talked about food. What kind of food is good for our spine?
Then also in connection to that, there's somebody who's asked about the kind of exercise that you may prescribe to also help strengthen the spine.
Yes. So basically, the food that we advise is, of course, things that will reduce weight eventually, because weight is a big factor for spine. The more weight you have, the more back issues you'll encounter in your life. And so from the word go, people should try to keep fit as much as they can in terms of, one, changing your kind of diet. And the kind of diet we always advise is what's called low caloric, or things with low carbohydrates with a higher protein content, because protein will build your muscles and less of fat. So basically, it's all about changing your diet to fit the natural way we used to eat before. That means low calories and high proteins. So we need to eat natural food as much as we can. Instead of eating bread, eat nduma or sweet potatoes. Instead of eating big portions of ugali and rice, change to eating big portions of vegetables, for example. That helps a lot. And that goes hand in hand with regular exercises. So we advise again that somebody should be able to exercise as often as possible, probably about 3 times every week. And basically about, when you exercise, you stretch your back, build your low back muscles. The whole idea is to have toned muscles on your low back. That helps support the back.
Are there specific exercises, or maybe they also may need to now see a physiotherapist for that, of course?
Yeah, there are specific exercises that tend to help the low back. And it's those exercises that strengthen the inner core. In the back, there is the inner core muscles. And those inner core muscles is what we need to exercise often. And there are specific exercises that we advise that I may not be able to demonstrate here, but there are specific exercises. And the best thing is to see your physiotherapist. They always know which exercises we advise. Yes.
Of course, we've had one physiotherapist from Tophill Hospital. Of course, we'll still have many more to come and maybe demonstrate some of these things for us. Daktari, thank you so much for making time to be with us. And maybe before you also give your parting shot, of course, there are so many testimonials and so many people celebrating what you've done before. And one thing that I may ask maybe outside the topic is, what keeps you going, Daktari?
Oh, what keeps me going?
That's because there's a lot of a lot of good testimonials. Of course, I can see even from WhatsApp a lot of people celebrating what you've done for them before and all that. What keeps you going, as you also gave us your parting shot?
Oh, basically, I think what I went through in my early life is probably what has pushed me a long way. And I went through a lot of pain myself when I was young. And the pain I had in my leg was something that has kept me thinking that no one else should have the same pain that I went through. So I always think that I cannot go home to sleep when there's somebody who is in pain. I know the type of pain that people go through, and I try as much as possible to contain people from having pain. And that is the main thing, helping people have quality life. And apart from that, many times we deal with emergencies. So maybe it's time to retire to home midnight, or then you get this call about somebody who is being brought in after an accident. At that point, things change. Even if you feel sleepy, you have to help somebody. So it's about life, saving life. We are in this profession not because of any other reason, but just to save life and make people have better lives. And I think that's my focus. My focus really is about changing lives, changing the quality of life somebody has. Apart from that, really, There's nothing else. Yes.
Okay, thank you so much. Your parting shot, Daktari.
Oh, thank you so much, Mr. Kalia. It's always been a pleasure to be here and talk about conditions and pass the same information to the wider public. Most of these things can be prevented if we really are careful on what we do. For example, the type of food, the way we sleep, the way we sit, all those simple, trivial things we ignore every day eventually contribute to be a big thing eventually. So my advice eventually is, let's go back to the basics. The basics is what has caused us all these troubles in our lives. And that is not just even in medicine, even in the wider public. We ignore so many things, the way we drive, the way we look at life generally, the way we eat, the way we don't care about even the type of, like for example, I was talking recently about cancers. We talked about it here, about the increase in cancers causing spine issues. And it's those simple things in our community. Instead of digging out weeds, we now spray. We buy these glyphosate, the Roundup type, and we spray our fields. Those chemicals sink into our soil. And tomorrow we plant vegetables and we eat, and those chemicals are in our vegetables. And eventually those are the things that causes cancer. And so really we need to think carefully on what we do as a community. Not just about chemicals, and also about other things in our community. Water, about spraying, all those are important. And we cannot stop talking about it every day. Otherwise, thank you so much.
Okay, thank you so much. Of course, that is Dr. F. Koech of Tophill Hospital. He is the CEO and lead surgeon at Tophill Hospital. Of course, we've talked about caring for the spine. If you feel there's somebody who may have missed this particular broadcast, of course, feel free to share the broadcast with them at 9:01 a.m. This has been the Morning Glory Show. My name is MC Kali, and until tomorrow, see you.
Karibu Tophill Hospital, a brain and spine specialty hospital dedicated to provide